You know, here at Fox 13, we've been investigating problems in veterans' health care since the VA scandals of 2014. And while the VA does appear to have made a great deal of progress, we are still finding veterans caught in a bind. Fox 13's Craig Patrick has the case of Gary Smith.
Gary Smith is a Vietnam-era Air Force veteran who wasn't feeling right but couldn't say why. And it was February in the heart of the pandemic.
VA, I mean, if he could not specifically define what was going on health-wise, they really didn't want people in the facility.
He had a Medicare Advantage plan as a backup for his VA health care, so he used it to visit his Pinellas County cardiologist, who could see what his problem was in progress.
He's sitting there looking at me going, "You're having a heart attack right now."
And that's when Gary went down.
My cardiologist called 911.
And he woke up in East Dunedin Hospital.
Shortly after I arrived there, 4 stents immediately.
The good news is they took care of him, and that Medicare plan did cover much of it. The bad news is the VA would not pick up any of the rest. He got this bill, and then this bill, and then discovered his problem with VA health care.
VA usually used to cover an emergency situation.
Actually, it does cover emergency services at non-VA facilities. And VA policy urges veterans to get to the nearest emergency department right away if they believe their health is in danger. But the VA denied him on grounds that what happened to him does not meet the prudent layperson's definition of emergency. Even though he has this letter from the physician which states, "I hereby attest that upon arrival in the emergency department, the patient met the definition of emergency." The denial also states a VA facility was available to provide the emergency services, though that's not where Gary was when he was in distress. And the denial notes the issue of timely notification. On that point, the VA policy does state failure to report emergency care to VA within 72 hours or 3 days from start of treatment may impact coverage. The problem there is that he was hospitalized for 3 days.
I wasn't stabilized till I had 4 stents, and I still needed 2 more, so they kept me in until Monday when they did the last 2.
And VA policy also states even if the notification to VA did not occur timely, the emergency treatment may still be eligible for reimbursement, but not in Gary's case or in others around the country. We know other veterans sued, and in 2019, a federal appeals court ruled the VA has to reimburse them for their emergency care outside of the VA. And that was a class action that includes veterans' claims from 2016 to future claims through 2025, which, pending further review, may or may not apply to Gary, who for now says he'll have to sacrifice.
Cut down on, like food.
Because he's now facing around $800 in bills on a fixed income.
Social Security, that's it.
Social Security is your only means of support for you.
Yes. It's just, putting me in a bind.
Craig Patrick, Fox 13 News.
Unreal, right? Now, we've reached out to the VA for comment on Gary's case. We haven't gotten a response yet, but we will let you know, and of course, we'll let Gary know when we do.